Good evening, everyone. This is State Senator Rob Martwick, and I want to welcome you to this Facebook Live discussion and update on the coronavirus, COVID-19. I'm here with my friend and colleague, Senator Villivalam. I'm also joined by Susan Reisberg, who is the nursing supervisor at the Skokie Health Department, as well as Avonda Thomas-Smith, who's the assistant director of the Illinois Department of Public Health. We're here to answer your questions about the novel coronavirus, COVID-19, that is now been classified as a global pandemic. I want to note that the best sources for information are the Illinois Department of Public Health and the Centers for Disease Control. When in doubt, please visit their websites. But as we do this, as this develops, we very well may be back here again doing this again, and we will continue to try and push information out to you as well. But please check in with the Illinois Department of Public Health and the Centers for Disease Control. Now, before I turn it over to my colleague, Senator Villivalam, I do want to tell you that the governor at 5 o'clock, about an hour ago, spoke, and he gave us an update on some of the things that are going on, and we're going to fill you in on some of those. But just a couple of quick highlights. There are 7 new cases in Illinois, 3 of which are in Cook County and then some in the surrounding counties. And because of this pandemic and the desire to really stem this, the governor has announced some pretty sweeping action. So any event of 1,000 or more people has been canceled, ordered canceled for at least the next 30 days. And the government is strongly suggesting that gatherings, private or public, of 250 or more are canceled as well. Schools will remain open at this time. The Thompson Center is going to be closed unless you have business with the state. We're not to go to the Thompson Center. There are a whole bunch of other things. We'll get to them, but let me just run through some of the quick highlights. Election Day is going to proceed on Tuesday, March 17th, but there is going to be expanded hours for early voting, and we're encouraging everybody to do that. Vote by mail applications can still be filled out in person at the election authorities. There are some other things that I think we'll go over with, but I think the real key from the governor's message, the mayor's message, and the county board president's message was we need to be really diligent about social distancing, and we're going to talk a little bit more about what that is. So that's the governor's update, and now I'm going to turn it over to Senator Villivalam.
Thank you, Senator Martwick, and it's great to be here with you all. Obviously, a very unsettling time that we're all facing. I want to thank our panelists for joining us and our staff for putting this together. A big thank you to Wright College for hosting us here today. And I also want to thank the governor for his leadership. As Senator Martwick has mentioned, the governor has repeatedly held a press conference to update the public in our state, and I think it's important to continue to get those updates. I think one item, in addition to what Senator Martwick had mentioned, was they're very much looking into the option of teleworking, I should say, with state agencies, and also asking private industry to consider the same. I will also just add on at the start, certainly I don't consider myself a public health expert, but please use our offices. That's what we're here for. Please reach out to us to let us know what your concerns are, questions are. We can help facilitate conversations with public health and with public health experts to make sure you get the answers that you need and deserve. And so obviously that's part of why we're here today. We thought this meeting would be helpful because we're hearing from a lot of our constituents with questions and concerns. We also are seeing a lot of incorrect and misleading information on social media, and quite frankly, even the news. And so we wanted to get some of our true experts in the room to update us on the situation and help answer your questions. So please make sure, if you're watching, include your questions in the comments so that we can make sure we answer them. We know that this is a very unsettling time. Quite frankly, I'm sure it's frustrating and concerning on so many levels. And that's why, again, we wanted to get together to make sure we have reliable answers. And I thought we would start out with letting Ms. Susan Reisberg tell us a little bit about the coronavirus and her best recommendations for keeping you and other members of our community safe and healthy.
And before we continue, you know, this is live, obviously, so we're doing this live. Apparently, we're having a little bit of issue with volume, so we're going to ask all of our panelists here to please use your outside voices. We'll all speak up, and we'll make sure that everyone can hear us. If you're having problems hearing, by all means, put a comment in the section that you're having problems hearing, and we can very quick take a pause, and we can adjust the audio so that it picks up a little bit better. So with that, Susan, big outside voice.
I can do that.
Good.
Good evening, and thank you for having me here. My name is Susan Reesberg, and I am nursing supervisor with the Skokie Health Department, and I'm representing the Skokie Health Department this evening. We are a certified health department located in Skokie. We are a small but mighty team, and I would like to emphasize the seemingly simple recommendations that you keep hearing from all of our officials, from Dr. Arwady, from Dr. Ezike. Washing your hands is crucial. Not shaking hands. We're all kind of fist bumping here, or elbow bumping. Staying home if you're ill. So important, staying home if you are ill. And I know there are issues with that, but that's what we are recommending. If you stay home when you're ill, you're not going to be spreading the illness. This is prevention for yourself and those around you. Now, we've been talking to many, many groups in our community, and the messaging changes a little bit depending on the kind of group we're speaking to, whether it's long-term care facilities, which we've spoken to the schools, we've spoken to businesses, and the basic information about the spread of coronavirus is the same. As you have heard, it is spread by droplets, so through coughing or sneezing is the main way that this is spread. We talk about social distancing. You've heard that term before. Social distancing is we want to be about 6 feet apart from our friends. And contact with an individual. We've been getting many, many, many questions from the community and from schools about what is considered social distancing, what is considered exposure. Currently, exposure is if someone is within 6 feet of an infected individual for 10 minutes or more. Symptoms of the coronavirus are similar to those that you would see with the flu or with the beginning of a cold. So it's kind of hard to differentiate at the beginning, and you have to remember flu is still out there. So in our public health minds, we're not always thinking COVID or coronavirus is the first thing that you've got. There's a whole list that we have to go through, and it has to be differentiated. Do you have a cough? Do you have a sore throat? Do you have a runny nose? Do you have fever? Do you have chills? Are you achy? These are things we will ask. And there's been a lot of confusion about who is exposed to someone. And that's kind of, it's a little bit on a case-by-case basis. So say, we don't want this to happen to you, but say that Senator Villivalam tested positive for coronavirus. And I had contact with him, some prolonged contact with him. And now Senator Martwick said, hi, how you doing? We had a 2-minute conversation, and he moved on. Who's the one that was exposed? Was it me? Was it Senator Martwick? It's not Senator Martwick. That's the correct answer. You get the prize. Okay, it's me. I was the one who had contact. Senator Martwick will probably be concerned. I'm going to be watching myself for symptoms because I had close exposure to a known case. So those are lots of questions that we're hearing from everyone in the community. And again, the best advice that we have for spreading this virus is staying home if you're ill. As Dr. Arwady mentioned in the press conference tonight, and I've been saying this to various groups, we are in a containment mode. And containing is we are limiting activities, as the governor outlined this evening, so that we can reduce large gatherings and prevent people from getting this virus and containing it, and we want to slow and eventually stop the spread of this virus. This is a new virus. It's in the family called coronavirus, which causes the cold, common cold, and various other respiratory illnesses. So it's new, and we're all kind of concerned about it because our bodies have not seen it before, and so we don't have mechanisms to fight this virus, and we don't have medication for it, like flu vaccine that we have, and we encourage everyone to get flu vaccine every year, right? This is new, so people are worrying about it. We want you to use the same precautions to prevent coronavirus as you would for the flu or for the common cold. And in light of the new guidance, I'm sure you know that in public, we welcome your calls to our department. We welcome your emails this evening. In light of the new guidance, I'm sure that we will be getting more questions. Many faith-based organizations and schools have been contacting us asking for advice on gatherings, and fortunately we received that guidance tonight. So I want to thank our elected officials for providing us with more exact guidance for doing that. And we will be able to pass that information on to the citizens and the groups that we are in contact with.
Well, thank you very much, Susan. That was very good information. We all appreciate that. How are we doing on volume? Are we okay? Everyone able to hear us all right? Good. We're getting a thumbs up over there. We like that. So I'm going to turn now to Yvonda Thomas-Smith, who is our Assistant Director at the Illinois Department of Public Health. And I'd ask you to brief our audience on how the state, the city, and other local governments have responded to this unfolding situation so far. And start by adding anything you think people should know in addition to Mrs. Reisberg's comments.
Absolutely. Well, thank you for having me here. I appreciate this opportunity to engage with our citizens on a different platform. So the one thing that I would add to what Susan shared, everything that she shared was absolutely correct. The difference that we see in coronavirus versus the flu is that one symptom of having a difficulty breathing, shortness of breath, is really kind of a textbook symptom, along with the cough, along with the dry, itchy throat, along with fever. But when we see shortness of breath or difficulty breathing, that gives us another alert that this could be something other than flu. So again, I just want to give you a little background. I am a nurse as well, and my entire nursing practice has been in public health. And what we're doing at the state is having real intention of having daily calls with the governor's office, daily calls with our Cook County, City of Chicago, and all of our local health departments. We have an 8:30 call every day. It's been going on since probably for the last 2 months. Several calls with CDC. Illinois Department of Public Health really believes that the science that the Center of Disease Control and Prevention offers us is a real-time science, current information. And so we, again, have those daily calls with our partners, our community stakeholders, and then weekly webinars. Because we know that everyone can access maybe our website, or everyone cannot access City of Chicago's website. And so we have different modes of redundant sharing of information, whether it's our calls or whether it's our webinars. And we do have weekly webinars, not only with our local health departments across the state, but also with our hospital partners. And every day we have a local call with the Illinois Emergency Management Agency. And so as you know, the director, Dr. Ngozi Ezike, and Dr. and Alicia Tate-Nadeau daily have calls to make sure that not only that we're responding in concert, but that we know what the left and right hand are doing. And so plans that the state has stood up is a 1-800 hotline, which is 1-800-889-3931, which is a hotline for anyone to call if they have questions. We also have email, dph sick, S-I-C-K, at illinois.gov, which is an email address that citizens or anyone or any of our partners can reach out to us. And that hotline and the email is manned 24 hours, 7 days a week. The state has also reached out to our federal partners to get SNS, which is our stockpile of supplies, which are personal protective equipment. And so you might say, well, what is personal protective equipment? That are our masks, our gowns, our N95 respirators for our EMS and healthcare worker protection. And I mentioned that it's for healthcare workers and our EMS protection because we don't encourage at IDPH to have citizens mask and gown up. Even though we are seeing early stages of community transmission, at this point, we're really pushing hand hygiene, stay home when you're sick, and cover your cough. We're also discouraging masking at this time, but encouraging social distancing, as was mentioned before.
Very good. So discouraging masking.
Absolutely. What we know is when you're healthy, the mask does not protect you. What happens in transmission, usually it's droplet, spray, and then people put their hands in their face or in their eyes, and that's how it's transmitted. So the mask is not really a filter that protects you, and we don't encourage healthy people to wear masks. They're really for those who are sick,
Yes, they're for
and
those
really
who are
for
ill.
those who are in healthcare, and for those who are EMS maybe transporting the sick.
Okay.
Well, thank you for that information. That's really helpful for both of you in terms of sharing that. I think we are collecting a few questions here. Please, if you have other questions, please leave them in the comments so that way we're able to make sure they're asked. Susan, did you have anything to add to what has been said?
I'd like to reiterate what Yvonne talked about with masks, because we still get questions about that all the time. Masks don't prevent you from getting the illness. Masks prevent the ill people from transmitting the illness to you. So the general population does not need to walk around wearing masks. The other thing I do want to talk about is hand gel, because we get a lot of questions about hand gel, and hand gel is in short supply, I understand, in many places. Soap and water is your friend. Soap and water is actually preferred because if you have soiled hands, if your hands are dirty, the alcohol-based hand gel isn't going to take care of that issue, but soap and water is. So again, you've seen posters posted all over the place of washing your hands for 20 seconds, drying them thoroughly, and turning off the faucets if you can with your elbow, if you have a paper towel, to use that. That really works. Hand washing, simple, but it's effective. Soap and water.
And can I just add about
Sure.
the hand gel? There's a misconception that the more hand gel you use, the cleaner your hands are. But actually what happens, the hand sanitizer is alcohol-based, and eventually it breaks down the skin, which is your barrier of protection. And so if you're destroying your barrier of protection, then you're more susceptible to illness. So it is best to just go old school, as my mother would say, soap and water.
Right.
You know, we have a graphic here. We're going to try and put a graphic on the screen here, and it's the best way to prevent illness is to avoid being exposed to coronavirus. I'm going to ask our little camera person here if they can find that one. Is that on there? That graphic's not there? Try that one. Is it up there? Okay. So so now what you're looking at is you're looking at this, and so they can hear us talk. They can't see our faces, but they're looking at this graphic. So let's run through this, right? Because these are some of the things that we said, and the best way to prevent illness is to avoid being exposed to coronavirus, right? Is hold on, we're technical difficulties. We don't have that graphic. Okay. This is how coronavirus spreads. So let's start with that one because we've got that one. So we've got this graphic up on there, and we've talked a lot about this, and we appreciate that. The virus is thought to spread mainly from person to person. And again, we talked about this. People were in close contact with each other through these respiratory droplets. And so this is about the social distancing that we want to provide. So we've got that graphic. Let's just go back, and we're just going to read this one. We don't have this graphic available. We're going to go ahead and read it.
We'll provide it.
Yeah, we'll provide it later. The best way to prevent illness is avoid being exposed. So let's talk about this, because I think this is going to be the most important message. And Susan, you mentioned on this, well, I think we all have. When you're home, and this is number one, stay home when you're sick and avoid contact with people who are sick, right? I mean,
Yes.
that is always going to be this, and I think that's really important now. If you're starting to feel like you're sick, caution, right? Let's urge caution. Number two, avoid touching your face. Now, this is a tricky one, right? People, we're so used to touching our face, and so this is something people are going to have to work on, but don't touch your face. Cover your cough or sneeze with a tissue, and then throw that tissue in the trash. So coughing in your hand is not really, it's better than nothing,
You
but,
can do this.
Go to the
Actually,
elbow.
this is better
Mhm.
than your hand.
okay.
Use your elbows.
Use your elbows.
Good.
Cover.
Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Now let's talk about that. So obviously, first of all, regularly touched objects, we're talking doorknobs,
Yes.
Yes.
the refrigerator, right?
Yes.
Things that you touch and open, drawer handles and whatnot.
Handrails, banisters.
Handrails, yes,
For
telephones.
keys. Keys.
Right? And now, it's interesting because, again, there's a big run on these disinfectant wipes. Are you saying we don't need those disinfectant wipes? Are they preferable? Is it just regular old household cleaner is good enough, or?
And bleach is also good, and it's really inexpensive. It's works.
2 tablespoons into a gallon of water, I believe, is the thing that they're talking about, right?
I believe so, but is that on the IDPH website?
It's
to
on the
check?
IDPH
Okay.
website. There is a recipe there for you.
Yes.
And as Susan mentioned, bleach is so much cheaper than the wipes.
It is.
And it goes
is.
a longer way.
And you
Yeah.
only need a little bit. You don't need like,
Yeah.
that's way overkill.
Right.
Yes, and so hopefully you can still access those products, but using bleach and water will disinfect. It will kill the coronavirus. The coronavirus is actually not that difficult to kill. It can live on surfaces for a period of time, and so we do want to clean and disinfect with these products.
All right, the next one is wash your hands often with soap and water for at least 20 seconds. I think that's going to be an important part, especially after going to the bathroom and before eating, and after blowing your nose, coughing, or sneezing. Wash your hands. Let's repeat that. Especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Wash your hand for at least 20 seconds.
And Senator,
20,
people
yes.
say, well, how long is 20 seconds?
I
You
can
know,
tell you,
it's happy birthday.
that's right. Everybody, every child who may or may not be listening, or the parent of those children in preschool, know that singing happy birthday twice or singing the ABCs twice will be 20 seconds, and that's enough time for you to be washing your hands. It's longer than most of us do on a regular basis, right? But that's 20 seconds.
Yes.
It is. You often see that, and so that's real important, and that really was something that struck me, was that 20 seconds. I was watching something on the internet the other day. Lather that soap up and make sure you get between your fingers and the nail
And the
beds, right,
nails,
too. You
yes.
got to really get the
Yeah.
nails, make sure those are washed.
Absolutely.
And if soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Now, you talked about how there's a run on this stuff, but again, I've heard that this is something that you can make at home.
There
Yes.
are recipes.
Yeah.
There are recipes online, I believe, IDPH.
And on IDPH's website.
And
Okay.
I do want to say, since we're on social media tonight, right? Please go to the trusted sources for your information.
Thank you.
Go to CDC, go to the IDPH website, which I'm sure Avanda will repeat. Those are credible sources.
Yes.
People come calling us or talking to us about this recipe or that recipe. No. You go to CDC, you go to IDPH, you do these simple steps that Senator Martwick has reviewed with us. They are simple, but they are effective. You want to, again, cover your cough, stay home if you're ill, wash those hands well.
Those are all good points. I think they sound basic, but we have to make sure we do it as
Yeah.
a community, as a
Absolutely.
state.
Right.
And I think that's important that we keep repeating it. Can you all talk a little bit about who this virus impacts more and less? You know, I think we need to kind of understand it from that perspective
Sure.
as well. And because I'm walking outside, I see seniors, I see kids, I see parents, and I think we need to understand who this impacts the most and how.
And Senator, before you answer, and I apologize for interrupting, but I think this is important. I was in an event yesterday, and I'm trying to give the elbow, and people were literally teasing me for giving the elbow. They were, "Oh, come on, I'm not worried about getting sick." And sometimes it's not about you getting sick. It's about preventing that virus from being spread to those people that would be harmed by it, right? So this is that one situation really with this where we don't want to be thinking about whether or not we're going to get sick. You might be perfectly healthy, and this may be nothing more than a bad cold for you, but it could be very, very life-threatening for somebody else.
Absolutely.
So let's think about those people, and Avanda, if you would, tell us who those
Sure.
are.
So the coronavirus is new. There are things that we know for sure, and there are things that we're still learning. What we're seeing in the largest impacted population are seniors. And in Illinois, what we're seeing in terms of the cases have been seniors over the age of 70. And our concern is that not only their age, but some seniors are fragile and some have other chronic health conditions. So conditions we're seeing emphysema, any respiratory issue, diabetes, any other chronic health condition and age we're seeing are at higher risk. But we learned today that we just have a case of a 9-year-old young man, but he is a close contact of an older case contact in the same household. So we haven't seen a significant increase in children. This is our first child. But everyone is at risk in terms of can be infected. But we're seeing most of the cases, even in China, have been the senior population.
Senior population, and then I've heard, and I want to make sure it's accurate,
Sure.
folks that have not the strongest immune systems.
Absolutely,
That,
yes.
that also are
That's correct.
at most at risk.
Mhm.
Again, as Avanda mentioned, diabetes, asthma, COPD. If you are on treatment for cancer, your immune system will be lowered. So
Or
people...
more fragile.
Yeah, or more fragile. And so these are people who are more at risk.
And that is why we've spent a lot of time, I'm sorry, Senator,
Yeah.
a lot of time working with our long-term care facilities. We did release guidance yesterday to restrict visitors. That didn't land as well because people want to see their loved ones. My grandmother, people say, my grandmother's turning 95. This is a milestone birthday. She has to have a birthday party. But because seniors are in close quarters, living residentially, and because they could be fragile, we've sent guidance that it's one visitor per day. The visitor has to be 18 years or older because a younger population just inherently has more germs or infectious processes going on. And then even that one visitor needs to be screened prior to seeing their loved one. So, and we list this guidance with our veteran population as well. And so, again, with the governor's announcement and with the increase in significant number of cases that we've seen in the last 24 hours, now it's a little more palatable. It's a little more acceptable, that guidance.
The other thing is, if I may.
Yeah, of course.
So for our long-term care facilities, and we had this discussion with them yesterday, and I'm very happy to announce that they have implemented all of these procedures prior to our meeting with them. If you explain to the family member why access is being restricted, they're generally really accepting of it. It's just, again, education, and people are getting this, and they don't want to spread illness to their loved ones or to anyone else in the facility.
Right.
So, yes, people are being screened, staff is being screened, visitors are being screened at facilities. This is all to help prevent spread.
And I'm very appreciative of that guidance. Look, these are hard decisions. We want to see our loved ones. We want to be able to do our jobs. And we have, workers in those facilities, and And even myself, Senator Martwick, were invited to our events. I had 3 visits scheduled to senior centers that I told them I can't come. You know, and it's out of an abundance of caution that we need to take those steps.
Absolutely.
One question we did get from some of the comments, Susan had actually spoke to something that you mentioned, was how long do viruses stay on surfaces?
So the guidance that I have, and Avanda, you can correct me if I'm incorrect, initially they said 2 hours. That's what we were hearing. And now we are hearing up to 24 hours that the virus can remain viable, so that if it's on a surface and this surface has not been cleaned, and someone was here tonight and someone comes in tomorrow morning and I'm touching and then I touch my face, which as you've noticed we're not doing,
Yes.
and we're learning to do that, I could contract the virus, I could get that virus. So up to 24 hours, the virus will remain viable, and that's why we're asking people to clean and disinfect commonly used surfaces.
Well, we're going to take some questions from people who've been posting questions, but while we do that, why don't we just take 1 second and while we bring those, let's put another graphic up. We've got this, if you have questions about the coronavirus, it'll give a number, and you got that there, and it did a little, yep. All right, so now you can see if you have questions about coronavirus, please call 1-800-889-3931 or email, and this is important, this is an important email, dph.sick, that's right, S-I-C-K, at illinois.gov. So those are a great place to have your questions answered. And I believe, did I hear that, you know, there's something that if we believe that people have, if someone believes that they have the coronavirus, that they should not rush to the doctor right away.
That's correct.
There's some guidelines for when you want to do that, and so questions about that, please reach out before you go to your doctor's office, before you go to a hospital. And again, I want to say, I heard that
Can I speak to that?
Yeah, when you.
Please,
If
yeah.
you're feeling, if you have the symptoms that we mentioned, fatigue, fever, dry cough, scratchy throat, shortness of breath, you would call your provider and let them know your symptoms. They'll do a triage over the phone, they'll do a screening over the phone, and then they'll say, meet us at the emergency room entrance, and they will mask you and take you in. Mask you to make sure that if you do have coronavirus or some infectious process going on, that you would not affect others. But you would give your provider at least an hour so they can prepare, and they will greet you at the emergency room entrance, mask you, and then take you in to be triaged and evaluated. And the one thing that I must say about testing for coronavirus, you will be tested for flu first. If your flu panel or results is negative, then you go to the next level of testing for corona. So it's not automatic. There are some screening questions. We'll ask, have you traveled? Or have you been exposed to a coronavirus patient? And then have you had your flu results negative? Then we'll test for corona.
All right, so we've got some questions. Let's
Yep,
go ahead
so
and proceed.
we asked one. The next question that we see in our comments is, can you catch this virus more than once?
So that's a great question.
That's a great question. We
So-
don't know.
We don't know, because coronavirus is a family of viruses, of 4 different viruses. So like the flu, can you catch the flu twice? It depends on the strain of flu that you have. Yes, you can get flu a second time, and we're thinking that because the corona is a family of viruses, it's very possible that you can get another case, but we don't know.
Okay.
All right, we got some more
we got
questions
A couple
being
more
handed
questions
in.
here. All right, we asked that one about surfaces. Is it better for colleges to switch to online courses, or is washing hands amongst the student body and faculty effective enough?
I think at this point, because we are really being strategic and trying to dampen the spread, many universities have gone on virtual. just to disband the large groups of students that could convene. As you know, some universities will have an auditorium of 300 kids.
Yeah.
And that would put them at risk if there were someone ill from corona. So I think we're trying to be strategic and look at large universities. The governor has talked to all of the sports organizations, and they're not allowing fans to come into the sports arena. So I think with the several strategies at the same time could kind of dampen the spread.
All right, and a couple more here. All right, this is a good question. Obviously, we've talked about schools continuing to be open. There's a lot of concerned parents.
Sure.
How would you explain what this situation and the coronavirus is to a child?
Sure. I would say to a child that I'm sure you've heard the word corona or you've heard the word COVID-19 from your parents or TV or your teachers. I would explain to them it's kind of like flu. You feel bad, you might have a fever, you might have a scratchy throat or a cough. And if you feel that way, alert an adult right away so that an adult can really evaluate or assess the illness. And then if there is some concern, then you may see a doctor to have a test to see how sick you are.
I appreciate that. I know Senator Martwick has young kids. I have an 18-month-old, and I see him at home, and he's touching his face constantly. And
That's what they do.
That's what they do, and so it makes you kind of nervous. But you know, like you said, we have to follow your guidance and take the necessary precautions.
And then the good thing, your 18-month-old is not exposed to those who are sick, right? And
Yeah.
so I want to help people, think relatively. We are concerned about children, but if your child is not around someone sick or hasn't traveled to the impacted countries, then it would be less likely that they would get it.
It's very important. So the next question is regarding testing. And we've seen a lot of conversation on this particular topic nationally, and there's some. The governor addressed it to some extent, and the best he could, really. So what is the testing situation? Are we able to provide enough tests for everyone that should get one, and so forth?
Yes.
Sure. So, the Illinois Department of Public Health laboratory was the first lab to go live and to be able to do the testing. And the reason that we did that is that CDC became overwhelmed with all of the countries and states that were sending specimens. And you may have one patient but may have 3 or 4 or 5 specimens, right? And so we were seeing a delay in getting our results, and we wanted to provide supportive treatment for those who may be impacted, right? And then we wanted to use our hospitals in the best way to care for those patients. And it was kind of difficult for patients to sit in isolation for 4 or 5 days and not know what their results were. So we stood up the lab for testing, and we can test now in the state of Illinois and get results in 24 hours.
Okay. And Susan, you were mentioning this before. What's the process, and we talked about this already, but what's the process for someone if they feel sick, to going down this route of seeing if they have coronavirus or not? Because I know that they'd have to contact their healthcare professional and get them to authorize a test, essentially, right?
Well, they're
Please correct me.
triaged by their healthcare provider. Either the healthcare provider will call us, or we have individuals from the community that will contact us, and we triage them at the health department in terms of their potential exposure, travel history, symptoms. If we feel at the health department that they require a test, and by the way, the testing that is done in our area has to be authorized. The testing that is sent to Illinois Department of Public Health must be authorized by the health department. You have to get a code, you have to get a number in order to go to the next level to get the test. So you can't just walk in and say, I want a test. I have to authorize that. So I will contact the provider, after I give you a number, I will contact the provider, let them know that the person is coming, so that they are prepared for them when they come, send the information that I get from the patient to the appropriate facility. That person, if they don't have a mask at home, and some do if they're healthcare providers that we have to send, they will be they will mask either at home and go to the facility, or they will be met and masked at the site where they are going to be tested. And as Evanda and I have both said, the coronavirus test is not the first one that is done. First, we do a test for flu, and then we do a respiratory panel. And so COVID, again, we screen for it, we authorize the testing, and then the facility does a couple of tests.
And then let me walk back how the results are sent. So after the health department contacts the site for testing and the testing is done, then we, the department, will contact the provider first. Then we will contact the local health department if it's a positive result. And then the health department will follow up with that patient.
Yes.
And the health department will do the contact investigation, like where have you been? Who are you around? Who's in your home? To see if there are any more individuals at risk.
And we will do contact tracing at that point. We will also, as Evanda mentioned, be monitoring a positive case. They will be quarantined at home if they are well enough to be home, and we will be contacting them twice a day, either if they don't have computer access or internet access, we will call them. If they have internet access, they will receive an email twice a day where they can record their symptoms, and we monitor that.
And some may ask, why would we isolate at home and they're sick? Why wouldn't they be in the hospital? If they're well enough to be home, it's better for them to be home in isolation than in the hospital, because in the hospital, there's more exposure to healthcare workers. And we're trying to, keep our healthcare workers well so they can take care of the sick.
So we would prefer that people who are able to are at home. And we the words quarantine and isolation are kind of used interchangeably. We kind of talk about, the health department talks about quarantine at home. Isolation is when you're ill enough to be in the hospital, you are in an isolation room. It's a negative pressure room so that air is not circulating through, you're not contaminating the hospital. Quarantine at home, questions might come up about how do you do that if you're with a family?
Yeah.
Well, if you have a dedicated room and a bathroom that individual can use alone, that's good. And as I say, that bathroom can be cleaned with normal disinfecting products. You bring food, you leave it outside their door. I know it's difficult, and it's for 14 days, but you're in your own home. It's better than being in the hospital. And so we would prefer that they quarantine at home. If they're unable to, or some scenarios have been that families go and live with, the relatives may go stay with another relative if the person doesn't have their own room and bathroom that they can use. So there are different scenarios that we go through with people, but it is best to be at home.
And just going off along those lines, if you are someone that has another health issue or has a regularly scheduled doctor's appointment, is there guidance on whether or not you should go to the hospital at this time, or go to the doctor's office, or go to a clinic?
Sure. If you're quarantined to home, it's for 14 days. And so if you had another doctor's appointment and it's not, that illness would not compromise you if it's a regular appointment, we would encourage rescheduling, but you really need to be quarantined for that 14-day period.
And I'm sorry, and I should clarify, I was asking just in general, if you don't have if you're not sick, or if you don't have the coronavirus, and you have a regularly scheduled doctor's appointment at the hospital or clinic, are folks okay to go to?
Absolutely.
Okay.
Absolutely.
You know, as we all do, we all have a yearly
Yeah.
doctor's appointment.
Absolutely.
Yes.
You
Yep.
know, and so forth.
We want people to live their lives like they typically would, right? If you're not sick.
Yeah.
Yeah. Absolutely.
So, and then, sorry, just to round up testing,
Yes.
I think we kind of answered this, but just to be doubly clear, why don't we, the question is, why don't we test everyone who comes into Illinois?
Oh, great question. So we don't have enough kits to test everyone who would like to be tested. As a matter of fact, we've been pressing the federal government to send more kits. We test anywhere between, we've tested as much as 200 specimens per day. Our average is about 80 per day, but we need more reagent. We need more test kits. And so we are concerned that without that infusion of supply, that we don't have enough kits to test everyone.
Okay.
So that's why we use a screening criteria to make sure those who really need the test get the test. Did that answer it?
Yes,
Okay.
I think so. It was
Okay.
clear to me.
Might have some more questions from the comments, Ram, as
Yes.
you want to take a look and see what
Absolutely.
we got there.
So while I look over these, another question we had is, again, about hospitals and doctors' offices. Since hospitals and doctors' offices are often chaotic, what can nurses do for me while I wait for my doctor?
Is this in general, or is this for someone who's been sent for, this is a doctor's office? Are we talking about coronavirus testing?
I would assume that we're talking about maybe someone that feels sick, someone that is going into the hospital.
Sure.
Well, I guess I'll do it from a doctor's office and hospital.
Mhm.
So for a doctor's office, if you're going in and you're ill, you will be masked. And the receptionists, the people up front will reassure you that you will be seen as soon as possible. Again, if we've sent you to a provider thinking that it may be coronavirus or you're going to have coronavirus testing, not only will you be masked, but you will be placed in a room prior to testing if they think it's going to be a coronavirus test. The same thing for the emergency room. If we're sending you there and we're suspecting coronavirus, you will be, as I say, masked and taken into a room to be isolated from the other population prior to testing. So people are being very reassuring to patients. I think that will continue because we know there's a high level of concern.
Yeah. No, absolutely. The next question I think we have here is, how long does it take for symptoms to appear after exposure?
That's a great question. And again, we're saying up to 14 days. That is why if someone has an exposure to a known case and they are self-quarantining at home because this was a positive that they were exposed to, we are asking them to stay home and self-quarantine for 14 days because it could take up to that time. And we don't want them out in the general population not knowing if they will develop symptoms and start shedding or prior, because we don't know when they start shedding. So for up to 14 days, yes.
Yep.
And then, Yvonda, we have a question about our first responders, our frontline workers.
Yes.
How are we making sure that they're safe, and are we prioritizing their safety?
Absolutely.
Obviously.
Sure.
in
So
situation.
as I mentioned, IDPH is on the call with emergency management every day to make sure that not only do they have the guidance that is pushed out from CDC, is that we walk through and what does that operationally look like, right? Because you can have a guidance and not know how to interpret that. And so we spend a significant amount of time interpreting the guidance. We also do a lot of training and drilling together. We also assure that EMS have personal protective equipment, which are masks, gowns, goggles, and they do a fit test to make sure the respirator is appropriate for the EMS. So we do a lot of training around that, a lot of planning and drilling to make sure that our workforce is safe.
And to add to that, that's the broader level, taking it down a step, actually to the ambulance personnel, the EMS, our first responders. When the dispatchers take calls from people who are ill, they are trying to get as much information as possible about the reason the person is calling to be transported They are asking about respiratory illness so that our EMS responders are prepared and appropriately garbed for when they are transporting a patient. Because if our EMS providers are exposed, we are taking them out of business, and we could be closing a fire station,
Yeah.
which impacts the community greatly.
Absolutely.
And also, we assure that they have guidance on sanitation and decontamination of
Of the
the
vehicle.
ambulance, the vehicle, and personnel.
So I think we're going to probably be running out of time here at 6:58, and I know Yvonne has to get somewhere. So, maybe what we'll do is we will forward these questions, and we will post more questions and written answers as this post stays up. You're welcome to come back and visit, and we will post questions and answers that have been asked here. And so I want to thank both of you,
Thank you.
for
Thank
joining
you.
us here today. Thank you, Ron, for the idea of putting together this Facebook Live, and thank all of you for watching. There's a whole bunch of people that you can't see that are behind the camera that have helped put this together. Thank all of you for your help. I just want to repeat some information here before we close. So there was news today, and you will hear more about this. The governor announced 7 new cases. We're canceling large events throughout the state. However, schools will remain open, and I think this is important at this time. We're assessing as we go. The Thompson Center is being closed unless you have important business with the state, and I think that that's the way most of the government buildings are going to operate now. Unless you have business with the state, we're asking you to avoid those buildings. The government has also asked, the governor is beseeching employers, every business that can allow employees to work remotely, to have them work remotely. Again, this is all about that concept of social distancing, and we want you all to participate in that social distancing. Another important point is that Election Day will proceed on March 17th. You know, it's a cornerstone of our democracy. Everyone needs to get out and vote, but we're going to have expanded early voting hours. And I will tell you, I went and early voted, and the processes by which the election authorities are making sure that they are cleaning and disinfecting between each voter. So it is, I felt very secure going there. So make sure that if you want to avoid the crowds on Election Day, that you take advantage of early voting, or you go and see one of the election authorities and fill out in person an application, and they will then send a mail ballot to you that you can then mail back. One other thing that's important, I think, for those of you who are going to be starting to be contained at home and doing more social distancing, Comcast is offering 60 days of free internet for people of low income. So make sure you reach out to that. And then the last thing that the governor and the mayor and the county board president said that I think is really important, and I think it's good that we end on this, and we'll put this graphic up one more time. Be a good neighbor, right?
Yeah.
This is all about us doing things for each other. So I told you earlier about the event I was at where people were saying, I'm not worried about myself. Don't worry about yourself. Worry about your neighbors. Worry about your elderly neighbors. Worry about your sick neighbors. Worry about your family members that might be dealing with health issues where this virus could really help affect them. So be the good neighbor by doing what you can do to contain the spread of this virus. But then also make sure that you're checking up on those people. If they're ill, call them on the phone, talk to them, check in and see how those people are doing in the event that they get sick and they can't take care of themselves. You may have to intervene and call the authorities so that someone can help that person. We have one important last question point, and then we'll put up a graphic and then we'll call it a day. So
This is regarding our election, and the question is regarding safety for our election judges. And I think, to Senator Martwick's point, I want to tell you all that the City Board of Elections, the governor, the mayor, Cook County Board President, they've all taken steps to ensure the safety of our polling locations, the safety of people that are working in our polling locations. I can tell you for the 39th Ward, there is a nursing home that was used as a polling location. They have switched Fairmont Care Center as a polling location to move it to Volta School. And they've also made it so that the nursing homes in the 39th Ward, I believe this is the case throughout the city of Chicago, the residents of those homes do not congregate to vote on election day. They will each be given an absentee ballot in their rooms and vote that way. And so, again, as Senator Martwick said, he voted today. They're taking precautions. We need to make sure that we do so, and I think that's happening. We have a number of more questions, and I think we will make sure to get those answers. I would say more than anything else, please reach out to us with your questions, comments, concerns. We're here to help. I know that the Illinois Department of Public Health is doing everything they can. They're trying to serve 12.5 million people right now with their questions and concerns and comments. We're fortunate to have Susan here from the Skokie Health Department, one of 7 municipalities that have a health department. But please reach out to them, but reach out to our offices so that we know what your concerns are, and we can help facilitate answers as well.
Right, and of course the Centers for Disease Control, the federal agency, please reach out to them, and then I'll ask our camera operator here to put this up one more time, this graphic. If you have questions about the coronavirus, and we're going to get that graphic up there, there's a little check mark, we're up, okay. If you have questions about the coronavirus, please call 1-800-889-3931 or email dph.sick, S-I-C-K, at illinois.gov. This is a great place to get your questions answered. If you have more of them, by all means, put them here on our Facebook feed, and we will do our best to get those questions answered to you by the experts, and make sure that you get good answers to your questions. But again, if you have more specific answers, you can email those questions. Someone from the Illinois Department of Public Health will answer them, and it is information that you can rely on, and that is important. So let's go back to our live feed here. And there we are. And so with that, I'm going to say one more time, thank you, Senator Villivalam. Thank you, Susan. Thank you, Avanda. Thank you again, all the people who helped make this happen. And thank you, all of you, for watching. And please, be a good neighbor, do the right thing, and we will all get through this together. Yes. Thank you all for watching,
Thank
and
you.
stay in touch.
Thank you.
Thank you.
Thank you.